Welcome to the breakout session entitled Developing Your Research Career, NCCIH Career Development Funding Opportunities. The goal of this session is to provide an overview of the priorities and funding opportunities for training and career development at NIH's National Center for Complementary and Integrative Health. It also aims to summarize the NIH submission and review process and offer tips for how to interact with NIH staff when developing an application. We are so lucky today to have Dr. Lanay join us for our forum, and it's my honor and pleasure to welcome her and to introduce her to this audience. But before doing that, I want to remind you, throughout her talk, you have the option of sending in questions through the Q&A feature on SpotMe. So I'll be monitoring and curating those questions and then delivering them to Dr. Mudd during our ensuing panel discussion. So please, as questions come up, don't hesitate to forward them my way. So Dr. Mudd joined NCCIH as a program director in July 2015. Her grant portfolio centers on clinical studies of movement meditation, including yoga, tai chi, and qigong. She's also the training officer and oversees NCCIH's training and career development portfolio. Dr. Mudd earned a dual major doctoral degree in kinesiology and epidemiology and completed postdoctoral training in perinatal epidemiology at Michigan State University. Prior to joining NCCIH, she was an assistant professor of kinesiology at Michigan State University, where her research investigated the health benefits of physical activity during pregnancy and the development of interventions to improve health behaviors among pregnant women. I've had the special opportunity of having Dr. Mudd be program officer for one of my grants, and many of our colleagues here have had nothing but great experiences working with her. So without further delay, please join me in virtually welcoming Dr. Mudd.
Thanks so much, Peter. That was a wonderful introduction, and I'm really pleased to be here today to share this information with all of you. And I do encourage you to write in your questions as we go along, and there should be plenty of time for questions and answers at the end. So here's an overview of what I'm going to go through today. I want to first introduce NIH in general for those who are not quite as familiar, and then go through the different career development funding opportunities that NCCIH provides before talking about peer review and how to interact with NIH staff. So for those of you who may not have been to the campus for the National Institutes of Health before, this is a picture of our clinical center where a lot of our intramural research gets done. And you can see at the bottom of the screen here the NIH mission statement as well. It's important to know that the National Institutes of Health is actually made up of several different institutes and centers that you can see listed out here. And each of these institutes or centers, or ICs as you'll hear them called, have a different focus in terms of the research priorities they have. And so when you're developing an application to the NIH, it is really important to first think through which institute or center is most aligned with your research interests. And then you want to formulate your application to fit with that institute or center. And so one of the ways you do that is by looking up the mission and vision and strategic priorities of the IC that you're interested in. And on the screen here, I have listed NCCIH's strategic priorities, as well as our current priority topics that are listed below on the bottom of the screen here. However, I have this big star asterisk to let you know that a new strategic plan is currently underway at NCCIH, and I anticipate that our new strategic priorities will be released next spring. And so it's important to also realize that our priorities and our scientific objectives do get updated from time to time. I don't anticipate that our new strategic priorities will be hugely different from those that you see here, but there are some exciting additions that you'll want to keep your eye out for. So in general, this provides a summary of the type of science that NCCIH funds. When we talk about complementary and integrative health research, we have typically divided that into mind and body practices such as massage or qigong or hypnotherapy, as well as natural products, which includes herbs and botanicals, dietary supplements, etc. We are looking at kind of reframing these different types of interventions into those that have a primarily physical or psychological or dietary therapeutic input. And we're interested in these different types of interventions for a range of outcomes. Certainly, we have had a large emphasis on pain management, but also thinking about other symptom management, as well as the promotion of healthy behaviors. In addition, we're interested in the mechanisms of how these interventions work, what their biological effects are, and how safe they are, and how they might interact with other health procedures that people may be engaging in. We do have a framework for clinical research that really spans the gamut from doing basic and mechanistic science to understand how these different interventions work, looking at the mechanistic impact and optimizing interventions based on understanding the mechanism, all the way through conducting efficacy and effectiveness studies to test whether the interventions work the way we want them to. And then finally, we've recently added this new bubble at the end of our framework for dissemination and implementation science. As the evidence base grows for complementary and integrative health interventions, we're really interested in then how do we get these into the hands of individuals that need them. And so when you're thinking about developing a training or career development funding opportunity, one thing you need to realize is that really these types of mechanisms don't provide the resources for you to do the full-scale efficacy and effectiveness work, which is a common thing I see a lot of trainees want to do. They want to answer the question, does this work? And before you can answer that question, there are several important building blocks that you first need to gain some information about so that you can appropriately design the larger scale trial to answer that research question. So these are some of the building blocks for natural products trials as well as mind-body trials for those of you who are interested in developing clinical trial research. Now, I'm going to move into the different funding opportunities that NCCIH offers. And before I get into specifics, I just wanted to point you towards a few resources. We have a webpage for our training and career development funding opportunities that provides a lot more details on each of the funding opportunities that I'm going to cover today. And as you can see, we have opportunities that span from undergraduate all the way through faculty level career development. In addition to the NCCIH website, NIH as a whole has a research training website that I encourage you to go to and look through and explore. I think these kiosks that are over on the right side of your screen are really very informative, and you can refine your search to the career stage you're currently at to understand what are the available funding opportunities for you. This can be especially useful if you think that your research goals might align better with a different institute or center and you want to see what different funding opportunities they offer. Now, before I talk about the funding opportunities that support your actual science, I want to make sure that people are aware of the NIH loan repayment program, because this can be really useful. So the loan repayment program, the goal is that it helps keep people in scientific careers by alleviating some of the educational loan debt that you may have accumulated. And so once you have your doctoral level degree, you are you are then eligible to start applying for the loan repayment program. You do have to commit to perform research at 50% of your time for 2 years. And if your application is approved, then the NIH will repay up to $50,000 per year of your qualified educational debt and taxes. And you can keep reapplying to this program until your loans are completely paid off. So I definitely encourage folks to apply. The due dates are in the fall of every year. This year it's on November 20th, so right around the corner. But as I said, it's available every year. All right, so now let's get into some more of the nitty-gritty. This slide provides an overview of the different funding opportunities that NCCIH supports across different career stages. We offer individual level F fellowships at the pre and postdoc stage, as well as supporting several institutional training programs across the country that you can apply directly to for the pre and postdoc phase. We also have a range of early career K awards, and then the goal is that you would transition into an independent investigator and start applying for R-level awards as well as cooperative agreements. Today, I'm going to be focusing only on the early career development awards, but I can certainly answer questions about these other mechanisms as well. So one of the K awards that we now offer for clinician scientists is a supplement to the KL2 program that is funded by the National Center for Advancing Translational Science, or NCATS. The KL2 supplements actually build on clinical and translational science awards and so CTSA programs. For those who aren't familiar, CTSAs are comprised of a UL1, which supports research goals, as well as a KL2 training program that supports an institutional training program for early career investigators. And then they optionally also have a TL1 for pre-doctoral training. And one of their primary goals is to train and cultivate translational science workforce. And so this KL2 program is specifically for clinician scientists. The NCCIH supplemental program will fund additional slots to this KL2 for scholars that have a doctoral level clinical complementary and integrative health degree, such as a DC or an ND or a DAOM, or perhaps a DPT. And you can see the notice here for more details. But basically, in order to apply, you would first have to contact one of these existing KL2 programs, because it would actually be the PI of that program that would submit the application on your behalf. These supplements provide up to $100,000 per year in salary support, as well as dollars for tuition and research expenses, and up to $10,000 per year for the mentor's research-related expenses to assist you with your project. So these can be really useful. In terms of other K awards that NCCIH supports that are at the individual level, we offer 4 different types of K awards: the K99R00, the K01, the K08, and the K23. And I'm going to talk about each of these in the next few slides. But before I do, I wanted to point out that for each of these different types of K awards, there are actually 3 different flavors that depend on what type of science you're proposing to conduct, whether or not you're proposing to do a clinical trial, or if you want to do a basic experimental study with humans. And so I have written a blog to try to navigate all those different choices, and I have the link here. Now, let's get into the differences between these different types of Ks. So the first one I want to talk about is the K99R00. I call it the in-betweener. Others, you may have heard it called the kangaroo. This supports late-stage postdocs for additional training for 1 to 2 years in a mentored experience. And then the expectation is that you transition to independence in the R00 phase. You do have to be within 4 years of starting your postdoc at the time of application. And I want to point out that the transition to the R00 phase is not automatic. It requires that you successfully complete your K99 aims and that you acquire an independent position that is preferably tenure track or tenure track-like. The application itself has to fully describe the scientific aims you have for each of those phases, and you can see the different levels of support here. The R00 phase is really meant to function like a small R01. And the idea behind the K99 R00 is to really support those superstars who are going to be ready to compete for R01 level funding within 2 to 3 years. If you think you need more time in mentored support before competing for R01s, then we really encourage you to consider one of the other K mechanisms, the K01, K08, or K23. These 3 Ks all function very similarly to one another and provide up to 5 years of mentored support at 75% effort. You can see the differences in salary and research dollars here. And the main difference is the type of degree that you have and the type of science you're proposing to do. So the K01 is really meant to support PhDs, whereas the K08 and K23 are for individuals with clinical doctoral level degrees. And these two differ in terms of the type of science you're interested in proposing. So some common programmatic advice for K applicants. The first thing that I generally talk through with individuals who are preparing an application for a K award is matching the scope of science that you're proposing to do to the level of support that Ks provide. Again, a lot of people want to do the Great American Study as their K award, and there's just not enough research support in Ks to support that. And so we really encourage folks to focus on collecting preliminary data on building blocks that will help them design a rigorous next step study. And one thing I want to point out for individuals who are interested in clinical trial designs, NCCIH will not support efficacy, effectiveness, or the quote unquote preliminary efficacy testing in K awards. And so if you're proposing a clinical trial, it needs to either have a mechanistic focus or really be focused on feasibility and acceptability testing to set up a larger scale trial in the future. You need strong mentors for K submissions that have a track record of successful mentoring, and the career development plan needs to be well justified. Overall, you really want to emphasize your potential to develop into a productive scientist throughout your application, as this is the main thing that reviewers are focusing on. Yes, the science has to be rigorous, but the majority of the funding in Ks is actually supporting your effort in your career development. So it needs to be really clear that you have a strong trajectory towards independence. Okay, so then how do you transition to research grants once you have the K? So one thing is to begin applying before you think you need to. You want to start applying during your career development award to anticipate that that first submission is not going to get funded and you'll have to reapply. You want to demonstrate the natural progression of your work and how this is contributing to an overall impactful research program. And illustrate how you've pulled together the right team and resources to continue this work. Overall, just like with the K, you want to make sure that you're matching the scope and purpose of your project to an appropriate funding opportunity and to the institute and center. And this is where program staff can really help. So NCCIH has a variety of resources on our webpage to help you with this transition. You can read more about our funding opportunities. Our funding opportunities are over here, our funding priorities, which, as I said, are likely to be changing a bit this coming spring as we release our new strategic plan. There are also different grant application resources on our homepage, and you can subscribe to our NCCIH update to see any new funding opportunities and new priorities that we might have. I do also want to point out a new supplemental program that the NIH has started this past spring to support K Award recipients. The goal of this supplemental program is to assist individuals who experience a critical life event during their K award. That critical life event might be things like childbirth or adoption or primary caregiving responsibilities for a family member. And if you have experienced this type of event, or you know you are going to experience this type of event in the case of childbirth, you can request up to $50,000 for 1 year to support the successful completion of your research. And so that might allow you to hire additional staff to help complete your science, or perhaps get some equipment or supplies that could help. So these are accepted on a rolling basis, and I encourage you to talk with your program officer if you think this might apply to you. All right, so now I'm going to briefly talk about navigating NIH peer review. And these are all the steps that happen for your application to become a funded grant. So first, when you submit an application to the NIH, it goes to the Division of Receipt and Referral. And they're going to read through your specific aims, your project summary, etc., to determine which institute or center is best aligned with the science that you've proposed. So you want to make sure that that's pretty clear in your application. Once it goes to that institute or center, it will then go through peer review, which is what everybody thinks of when they think about NIH review. So this is the study section that is evaluating the scientific and technical merit of your application, taking into account the review criteria that is set forth in the funding opportunity. Once peer review is completed, you get that impact score, and you also get a summary statement of all of the reviewer comments. The program staff then have the opportunity to go to do programmatic review of your application. And so that's going to take into account the reviewer's evaluation from peer review, but we also take into account programmatic priorities and gaps in our portfolio to decide which applications should be recommended for funding to our National Advisory Council. So then at that point, your application will go to the National Advisory Council level of review, and they're going to evaluate both peer review as well as programmatic recommendations and make their own recommendations. And then finally, it's the IC director that makes the final funding decisions with input from all of these previous steps. So it's important to think about all of these different audiences that are reading your grant. So in terms of the review criteria, this is something that you can read about in the funding opportunity announcement, as all of the review criteria are clearly laid out in the funding opportunity itself. And so for career development awards, reviewers are evaluating these 5 primary components. You as the candidate, your career development plan, the research plan, your mentors, as well as the environment. They're taking all of these things into account to come up with an overall impact score that assesses the likelihood that the proposed career development and research plan will enhance your potential to become an independent scientist. And so that's the overall impact score is what gets reported on the summary statement itself. And so this is a picture of the summary statement. You can see, you find out who your assigned program officer is on the summary statement. And then most people jump right to this impact score section. And if this was your summary statement, you'd be very pleased, as this is a very good score. If your application was not discussed, the impact score would just have a few plus signs right here, which would indicate that it was not discussed and thus did not get an overall impact score. So the summary statement is the official communication between the government and you. It summarizes the key strengths and weaknesses identified by reviewers. If your application was discussed, it will include a resume that is written by the scientific review officer that summarizes the discussion. If it was not discussed, well, in either case, whether or not it was discussed, you will have, in addition, critiques from each of your assigned reviewers with criterion scores for the 5 core review criteria and their own perceptions of the strengths and weaknesses of your application. All right, so now let's wrap up with some tips for talking with NIH staff. So one thing to realize is that there are a couple different people you might need to interact with depending on what stage of application you're at. In the pre-application phase, you want to talk with program officers. And with program officers, you're going to be wanting to contact them several months ahead of the due date to discuss the scientific priorities and the scope of science that you're proposing and how well that fits with scientific priorities at the institute or center and with the funding opportunity you've chosen. Once you've submitted your application, you might need to interact with the scientific review officer. And so with the scientific review officer, you might be discussing things like the fit of your application with the study section that it was assigned to, as well as allowable post-application materials. For example, if you've had a publication get accepted and you want to make sure that the review panel is aware of that. And then post-review, you again talk with program officers to discuss whether there's potential for funding or whether you might need to start thinking about a resubmission. Now, one key piece of advice, I always recommend waiting at least one day after the summary statement has been released before requesting that call so that you can get your emotional reaction regulated and be prepared for that conversation. And I do want to point out that actually program staff are not allowed to talk with you until the summary statement is released. So I often have individuals email me the day after study section once their score is released and they want to talk. And I'm not allowed to talk with you at that point in time until that summary statement comes out. So pre-application, a few tips. In your introductory email, please include the specific funding opportunity you're considering, as well as a brief description of yourself and your project. And if you have specific questions, go ahead and put them out as bullet points and attach a draft of your specific aims. Having all that information up front allows program staff to quickly review and decide, is this a good fit for NCCIH, or do I want to immediately send them on to a different institute or center? And you know, that's one thing to remember, is that a no is not necessarily a bad response. It just means that's not a good fit for NCCIH, but maybe it is a good fit for the National Institute of Mental Health or the National Institute of Aging. And I do encourage for trainees and career development applications to include your mentor in conversations with program staff when possible. Post-review, I definitely encourage you to read that summary statement and discuss it with your mentor first, and then email to request a discussion of the critiques, and be aware that we might request a written response to the summary statement to help us with that further programmatic level and council level review. So in sum, here are some key points that it's really important to match your science with strategic priorities of the different National Institutes of Health institutes and centers. You can use the main webpage to select a training or career development funding opportunity. One other resource I haven't talked about yet is projectreporter.gov. This is actually a list of all funded NIH grants. And so you can search to see the different type of science that we've been funding in areas of interest to you. And it can also help you identify other PIs who are working in that area and that you might want to include in a mentor team, or maybe reach out to see if they have a postdoc available, that type of thing. Contact program staff early when you're preparing an application. Read the entire funding opportunity, especially those review criteria, and then review the summary statement with your mentor before contacting program staff, and always be thinking early about the next step of your career. So I will go ahead and end there. I think actually I got through those slides faster than I normally do, so I probably went too quickly in some parts. So let's open it up for question and answers.
Such a great overview and very informative and very practical. So I've been monitoring the question board, and I have a couple that have come in, and so I can start with those if you're ready. One comes from a person who's been in research for a while. They're in their sixth decade of research, but they haven't submitted any NIH grants, and they're wondering if they still qualify as a new investigator.
You do still qualify as a new investigator because you have not submitted an NIH proposal. You do not still qualify as an early stage investigator because that is defined as being within 10 years of your terminal degree or training. And, you know, I would say in terms of career development awards, it would likely be somewhat difficult to apply to a K and justify the need for further mentored research training. But I would recommend, you know, as you start to think about preparing an R-level application, that it might be really useful maybe to go in as multi-PI with an experienced funded investigator that, you know, you could still be getting some of that mentorship from, but just in a slightly different way.
Super, great advice. So another question is, and I assume that you're limiting this discussion to the career awards, but maybe it spills over into R's and U's. But can applications be funded by multiple NIH institutions if the question is very interdisciplinary?
Yeah, that's a really good question. And the reality is, you know, certainly as science is going in the direction of being interdisciplinary, that oftentimes you might have a research idea that really overlaps across several different institutes or centers' priorities. And so when you are applying for R-level awards and U-level awards, certainly oftentimes there is potential for co-funding across different institutes and centers. That is less likely to occur in a K award. And part of the reason for that is actually that most institutes or centers review K awards in-house with special emphasis panels. And the other thing is, you know, when you think about a career development award, it's really institutes and centers are looking to support individuals they think are going to stay within the area of science that, you know, matches the priorities of that institute or center. So what I often recommend to applicants is, you know, if you have an idea, you think, okay, this is, maybe it's about a mind-body intervention, but it's a older adult population, and maybe it's for depression. So you're thinking maybe it's NCCIH, maybe it's NIA, National Institute of Aging, maybe it's NIMH, National Institute of Mental Health. I really recommend reaching out and talking to program staff at all three ICs and gauging which program staff seems most excited about this idea. And then thinking about how to really, you know, gear your application to that institute or center and make it align most strongly with that one.
Thank you for that thoughtful answer. A quick one, you talked about the difference between K01, K08, and K23, and how the latter two are more for clinicians. Are those clinicians defined in the broad sense of they could be DCs or DAMs? And
yeah,
not just MDs.
Absolutely. It's any clinical degree, and that actually includes PhDs that are clinical, like a clinical psychologist as well.
Fantastic. You also made the distinction between basic research with animals, basic research with humans, and clinical research with humans. And where would, you know, this came up within our group, someone who's interested in developing a bi-directional translational model. In other words, they might want to do some kind of the impact of stretching on a mouse model, but then explore that in a human model as well, or humans. Does that pose challenges for deciding what kind of K mechanism to use?
Yeah, I mean, I think that would certainly be something to talk through with the program officer to make sure you're selecting the right K. The K08 is really centered on basic and translational science. And so if you're a clinician, then I think the K08 is likely the best fit. The K01 is very broad and supports really any kind of science if you're not a clinician. The tricky part would be determining whether or not you need to apply to the clinical trial required version or the basic experimental studies with humans version or the no clinical trial version. To decide that, if any of your research aims includes a clinical trial, then you have to apply to the clinical trial required version of the funding opportunity. If none of your aims include a clinical trial, then you can go with the no clinical trial version. The basic experimental studies with humans is somewhat of a tricky one for people to understand. This really refers to research designs that are experimental, so they are manipulating things and assigning people to a condition. Maybe they're going to practice a meditation or not, but they don't have any clinical application in mind. And so it's really a very basic and mechanistic research question that maybe they're looking to see like what brain regions light up or not, but with no kind of clinical application in mind.
Okay, I'm just keep looking over to see if there are any new questions. Nothing coming through right now, but I wanted to echo some of the comments you made about thinking of the application in a holistic way. Having sat on a number of these review panels and mentored our own students in applying for Ks, I think your point about thinking of this as multiple pieces of a puzzle that all fit together is really key. What is your background? How does this particular application take you to the next step that's going to prepare you for an independent career? How is the team of people that you've assembled to be your mentors going to contribute to that? How does the environment support those things? And then, of course, the questions and the science that you pursue. So I think people, get focused on just the science and they forget about the whole package. So thinking big is really important. And then one thing I will share personally is, at the same time, attention to detail is incredibly important. Mm-hmm. You can have a really great plan and all those things in place, but if there are silly things like typos and the formatting isn't quite right, or somehow that bibliography problem gets messed up and the references don't link to the right superscripts, that'll drive reviewers crazy, and they wonder whether this is the best use of funding. If people are not paying attention to those details now, do we trust their science later? So I think some of those points that you made, I just wanted to echo those. I'm not seeing any new questions coming through. We still have a few more minutes, so I don't know if you want to elaborate or branch off of on any new topics.
Yeah, I mean, I think the one thing that I miss about in-person conferences is having the opportunity to chat with folks in the hallways and get to know trainees as they're thinking about starting to develop applications. I want to encourage trainees and those that are early in their career that NIH staff are people too. We're not scary, and we really love talking about your science. In fact, I would say it's my favorite part of the job, honestly, is to have conversations with folks about their specific aims and their application, and whether it fits with NCCIH or if I think it's a better fit somewhere else. And so don't be, I guess, intimidated to contact program staff. We are here as a resource for you. This is the main part of our job. And so I do encourage you to reach out early. I hate to see applications come in that, I've never talked to and nobody in my branch has talked to. And inevitably, those applications do not review well. And the reason is that they have not had a chance to talk with program staff about the fit of the science and the scope of the science with the funding opportunity and with the IC. So please take advantage of contacting us, and give us enough time in advance to make sure we have time to set up a conversation. Oftentimes my schedule is booked for, up to 2 weeks. And so sometimes it takes a while to get that scheduled, but we do like talking with you. And it's always fun to hear the different research ideas that people have and discuss those with them.
And I just want to echo that my experience with Dr. Mudd, but all the other officers, not only at NCCIH, but all the other institutes that we've applied to, really do consider this one of the most important parts of their work. And if they can catch ideas upstream, they really enjoy, obviously not giving people specific advice, but helping them shape their applications so that they best fit their portfolios and have their best opportunity. But I also want to echo what you said, Dr. Mudd, and it's something that we teach our fellows, is be thoughtful in reaching out to your program officer. You guys are really busy. You want the emails that go out at the right time to be professional. Sometimes I'll even, with my early trainees, review their emails, and I'll encourage them to write an email to you, but I'll say, let me read it first. And that's part of the training process. And like you said, can you send specific questions? Can you send drafts of aims? And so I think as friendly as you are and as willing to help as you are, I think there's also that sense of preparation and respect that will most leverage the opportunities that you guys provide.
Mm-hmm.
There's a question here that you can see, Dr. Mudd, in the chat line. Can you?
Yes, I see a couple of questions. One is about assessing environment, and what if the university that you're at does not have a strong emphasis on integrative health, and is there a possibility for mentors from other institutions? So I think this is a great question. Definitely as you're preparing a K award, you want to make sure you have strong mentors. And it's okay if those mentors are at other institutions, as long as there's a really clear plan in place for how you're going to communicate with those mentors on a regular basis, and how actually the mentors are going to communicate with each other as well. And so you want to make sure that that's clear. I think in these days of Zoom and everything else, that's a lot easier than it used to be. It is often very useful to have a mentor that is at your institution that can help you with some of the practical nuts and bolts things, but doesn't necessarily have to be your primary mentor, and they don't necessarily need to have the same research interest that you have, as long as it's clear what their role is. In terms of the environment, reviewers are looking to see that the institution has the correct resources to support your science. And so you want to make that clear, and maybe if the institution you're at doesn't have all the resources you need, but there's a nearby institution that also has some resources that would be useful, you can work to collaborate and make that possible. And then I think the other question here is about whether or not NCCIH would fund research on developing interventions for healthcare staff, taking a note from the keynote this morning about burnout, etc. And the response there is absolutely. We actually we're currently funding several projects that are kind of in the feasibility stage of developing mind-body approaches to address burnout in a variety of first responder professions, and we're very interested in that. We're also very interested in outcomes like emotional well-being. We had a really nice roundtable discussion about that oh gosh, it's almost been 2 years now. But we've had some funding opportunities along those lines as well. And that would be for a variety of populations as well. So definitely that's very relevant science for NCCIH as long as there's a complementary and integrative health approach that is being used.
Super. I see a question here, a number of people saying thank you, not surprisingly. Are some topics of particular interest when comparing the areas you presented? Maybe areas lacking investigation?
Yeah, so I would say stay tuned and definitely read our strategic plan as it comes out, as some of these priorities are still kind of being formulated and well-defined. But I can say from my perspective, one area that we're really interested in is remote delivery and mHealth approaches. This was actually an area of emphasis that was coming out last March, right as the pandemic started. And now with the pandemic, it has become even more relevant. When we think about some of these mind-body approaches, how could we deliver them in a remote way? And, what might we be losing by doing a remote approach? What might we be gaining? And how well does that remote delivery work for the different health outcomes that we're interested in? And so we do have an R01 level funding opportunity for remotely delivered complementary and integrative health approaches, but certainly as a trainee, you could be doing some of those developmental building blocks to get yourself ready for that R01 level funding opportunity later on down the road. So that's one example. I think that another example is, like I said earlier, implementation science. That there's some interventions that we have quite a lot of evidence for at this point, but they're still really not in the hands of consumers and healthcare providers. And how could we, do better in that regard? So I think that's another emphasis area that is likely to be in our new strategic plan moving forward. But certainly, in terms of, in general, we're very interested in mind, body, and natural product approaches for symptom management and for health promotion and resilience and return to health. I think that all of those topics are of primary importance. And one thing that we are focusing on moving forward is also, the potential of multi-component interventions that might maybe include many different approaches to address multi outcomes as well. And so thinking about the integration of response across different body systems. I'm sure that you can watch Dr. Langevin's council presentation on our NIH videocast for a more eloquent description of those priorities in her council presentation from September.
That's really helpful. There's one new question here. Maybe this will be the last one, so we have a little bit of time between the transitions. But does NIH consider theoretical biology research for funding?
I am not sure that I know what theoretical biology research is. It's too bad we can't open up a dialogue with this question. So I guess my recommendation would be to send me an email with a little bit more description, and we can certainly have a conversation.
Fantastic. Well, unless I don't see any new questions coming in, I think this is a really nice way to transition to me thanking you again for such a comprehensive and informative and really well-delivered presentation. I'm seeing lots of comments here in a chat feed that you can't see saying thank you, thank you, thank you. So I want to thank you again on behalf of the Osher Center and our whole team here. We really appreciate this opportunity for you to teach us how to efficiently take advantage of all the fantastic resources at NCCIH.